Hi everyone, you're very welcome to the Camogie Association Self-Care Series. This is our first webinar in the series and it is a snapshot into sexual health. So today's webinar will be delivered by Dr. John Crowley and Dr. James Nolan from your GP in Ballincollig and Cork. So I'll pass you straight over to them to begin tonight's webinar.
Thank you very much, Louise. And thank you very much to the Camogie Association for giving us the opportunity to engage with your members, both male and female, for the purposes of sexual health. So we'll go ahead and discuss the common sexually transmitted infections for all concerned, and also Dr. Nolan here will go through some contraception options that are available to everybody, and we'll also touch on some prostate health take-home tips for the gentlemen in the association. So to give you a little bit of background about myself, I'm a GP in Ballincollig and Cork. I'm also a GP trainer with a keen interest in sports medicine, having completed the Masters in Sports and Exercise Medicine in UCC. I am a passionate hurler, GA man and Camogie Association follower, and I've experience in a wide range of medicine, but primarily now general practice, sports medicine, disease prevention and health promotion are the areas I focus on. Dr. Nolan will introduce himself now, and then I'll go ahead with the first part of the presentation.
Thanks very much to John, and same to yourself, Louise, for giving us the opportunity to speak tonight. Just echoing what John said in terms of my own keen interest in sports medicine, camogie and hurling. I'm a GP registrar working here in the GP clinic in Ballincollig, with the aim of becoming a fully qualified GP in the coming year or two. Following John's talk on sexually transmitted infections, I will be discussing contraception. So I'll hand you back to John now and let him take away the presentation.
Thanks, James. So we've kind of covered our introductions, but going on to the sexually transmitted infections, they're very common in Ireland, and these infections are on the rise on an annual basis. Naturally, they are spread through sexual activity, sexual intercourse, and skin-to-skin contact. There are various, relationships regarding sexual activity, heterosexual activity, homosexual activity, and other bisexual activity. In terms of these sexually transmitted infections, they're preventable, and they're preventable through a number of ways. Of course, behavioral practices, also barrier contraceptive methods, which James will go into in more detail, and other educational exercises just like this very subject and this topic tonight. It's a very important subject, and we want you to attend for medical opinion if you are concerned. There's various ways to do that, and that's through any general practitioner, local or otherwise, or an STI clinic near you. Now, the general practitioner is free for all those who are medical card holders at the moment, but thankfully the government are rolling out a free sexual health service for everybody in the community, and through the local sexually transmitted infection clinics, or GUM clinics, the genitourinary medical clinics. Now, free home testing kits are available in many areas of the country since the start of October 2021, and you can access these home free test kits through sexualwellbeing.ie. Now, it is important that these are for people without symptoms. I actually went on to sexualwellbeing.ie myself this week and completed the patient journey just to experience it. And I must say it was extremely efficient, discreet, and secure, using two-factor authentication for the patient who seeks these home kits. So please go to this website, where there's a superb array of information regarding all sexual health for everybody in the community. What are the infections that we're going to focus on? There's just a couple that we need to be mindful of. Chlamydia would be the most common infection from a sexual perspective in Ireland. There's up to 8,000 infections per annum, and these are 2018, 2019 figures. So we expect them to be higher at this moment. It's caused by bacteria that leads to, in fact, no symptoms in many cases. So the male or female in the community will not be aware that they have chlamydia unless it's in the late stages. The test for chlamydia is very straightforward. The lady does a self-swab, a self-vaginal swab, and that will be incorporated in the home test kit that I just referred to. Or also, the lady can use a self-swab provided by the GP or by the STI clinic. The gentleman can use a urine sample, and again, provided through the same sources just mentioned. There are long-term consequences to a chlamydia infection that remains untreated. Unfortunately, in ladies, it can cause pelvic inflammatory disease, and this is a disease that affects the womb and the fallopian tubes and the ovaries, leading to subfertility and infertility. And it can also lead to complications in the gentleman as well, in terms of his fertility. Prevention is done through, safe sexual practices, use of barrier contraception. Now, gonorrhea is a subject that many people in the community are not familiar with. There are about 2,500 cases per annum in the community, and this is also on the rise. It's unfortunately soon to become an untreatable condition as a result of antimicrobial resistance. Again, it's sexually transmitted. Symptoms, in some cases none, but in others it may lead to a vaginal or a penile discharge. The test is the same test, in fact, as chlamydia, so that's why we've included it on the same slide. And treatment is with antibiotics, but we have gone through perhaps 6 courses of various antibiotics to date. And the reason we are moving from course to course is due to the frightening development of antimicrobial resistance regarding gonorrhea. Prevention is through barrier contraception and safe sex practices. Other common conditions include genital warts. This is as a result of the human papilloma virus. Now, very fortunately, there has been a really significant decrease in the prevalence of genital warts in the community, resulting in almost a 60% decrease in the last 8 years. And we think this is primarily due to the rollout of the human papilloma virus, the human papilloma vaccination and the Gardasil vaccination, which is proving spectacularly effective. Australia are the global leaders in this regard, and in the near future, we hope to reach the levels of disease prevention that they are managing to achieve. Treatment of genital warts. Number 1, they need not be treated. Number 2, if they are treated, they can be treated using cryotherapy or liquid nitrogen. The long-term complications, I want to make it quite clear, it does not increase your cancer risk. It is a different form of human papilloma virus does this. And again, prevention is through safe sex practices. Genital herpes, however, is a different condition. It is caused by the herpes virus, the same virus that can cause cold sores. It's a very, very painful experience to have genital herpes. They are sore, red, painful, vesicular-like lesions, which are those lesions there on the screen. The test is a swab or a blood test of the actual lesions, and treatment is through antiviral medicine. The long-term effects, it's a distressing condition to have, because these herpes virus these herpes can go into remission, and they can remain dormant. And unfortunately, at times of stress, times of fatigue, or times of severe strain, these herpes lesions can reappear at a moment's notice, without a moment's notice. And as a result, if one is in a monogamous relationship, having experienced herpes in the past, unfortunately, the herpes can present many, many years later, despite having the same sexual partner. In terms of syphilis, syphilis is quite a concerning sexual transmitted infection, where it leads to the development of what we call a painless canker. And that's a picture of a painless canker. And that's a red ulcer that appears in the genitalia, and it lasts maybe up to 10 weeks, potentially 12 weeks in some cases. However, it can also present with a local lymph node becoming enlarged. So in the groin, you might have a bump or a lump, or many bumps or many lumps in the lymph nodes. That's a reactional lymphadenopathy. So believe it or not, people sometimes say, oh, this is just getting better, and it might get better spontaneously. One might subsequently not realize that they have contracted syphilis because it got better itself. However, it presents in a secondary phase, and that can be a rash on the hands, a red rash on the hands, or a red rash on the feet. And once again, that can also present at a later stage, many months after the sexual encounter, and it also burns out, i.e. it gets better itself. So that rash can subsequently burn out. And then many, many, many years later, decades later, one can develop neurological complications or cardiovascular complications that could be as a result of syphilis. And both James and I have seen this in our career to date, and it's on the rise. Syphilis has had a 76% increase in presentations in Ireland over the last number of years, and that's information from the Department of Genital Urinary Medicine in St. James's Hospital in Dublin. It's more common in males than females, and it's more common in males who have sex with men, more so than heterosexual individuals. Genital lice, that's mentioned too, because genital lice is something that we should all be aware of. It only presents in the pubic area or in the axilla, the armpit. It doesn't present in the scalp. It's skin-to-skin contact transmission, and the treatment is by cream prescribed by the general practitioner, and really a clinical diagnosis is made by the doctor. Little testing or sampling is required typically. Finally, we can just consider human immunodeficiency virus, HIV. Now, HIV is on the increase, but we're thankfully coming across it earlier because we're testing more. There are approximately 600 cases per annum in Ireland, and of that, females account for about 100 to 150 cases per annum. And it's a standard part of a sexual health screen. It's to be done if ever there's any concerns regarding a sexual encounter. And if one is sexually active, should one be tested regularly? Absolutely, yes. So on that note, in fact, Louise, if there are any questions that you have from members, we'd be delighted to answer them now, or we can answer them at the end when you have a moment. But I think for the purpose of the presentation, I'll hand over to James at this stage, and he can go through the various contraceptions. Thank you.
That's great. Thanks very much. And just the first point I'd like to make on this is that when we're talking about contraception, we're talking about avoiding conception, not avoiding the STIs that John had just discussed, other than barrier methods such as the male condom. So now the contraception going forward in the future, it'll hopefully become more freely available to people. As you're all probably aware, in the recent budget, it will now be available freely for those 17 to 25, with the hope that this will be expanded into the future. So there's, as many of you are aware, there's many types of contraception available, from the oral contraceptive pill, those that are implantable into the arm, or injectable intrauterine devices, and the patch or the ring barrier contraception, and then emergency contraception. We try our best to tailor the various contraceptive methods to the person, whether it be that might suit them in terms of side effects or the ease of use and things like that. So the first one I'd like to talk about is the oral contraceptive pill. Many of you know of this. The combined pill is the first one, and this contains two different types of hormone, estrogen and progesterone. Examples of this that you might be familiar with will be Ovrina or Yasmin. And generally, this is taken daily, with a break was the classical use, where you'd take the pill for 21 days with a 7-day break, allowing a withdrawal bleed. In recent years, this has changed to either have a 4-day break or even no break at all. It is an extremely effective form of contraception when taken perfectly. By that I mean taken at the same time every day. It can be up to 99% effective at that rate. However, typical use, which accounts for people taking it in different times each day, or maybe missing a day, leads to the efficacy falling to about 91%. So this means that about 9 out of every 100 ladies will become pregnant while taking it over the course of a year. I suppose the disadvantages, and maybe the people that it is not suitable for, will be people that have a history of high blood pressure, have a history of migraine with aura, or people who have who have had a history of maybe having a blood clot. There is a very low increased risk of breast cancer, but this reverts to the baseline of the rest of society after 10 years of stopping it. In terms of missing a dose of this, if you miss just one pill in the day, you should take this as soon as you remember it, but no further care or caution is needed. If greater than one pill is missed in a row or per pack, you should use contraception for the following 7 days. And then moving on to the progesterone only pill, or the mini pill. And this, as the name suggests, contains progesterone only. Similar to the combined pill, it is taken daily, but without a pill. Again, it is 99% effective with perfect use, but similar to the combined pill, falls to 91% effective with more typical use. Cerazette will be the example of the mainly prescribed one. I suppose advantages of this is there's a wider window if you miss a pill, in terms of you can take it within 12 hours each day. Disadvantage of it, again, similar to all the other ones, it does not protect against sexually transmitted infections. Also, a number of women will have bleeding or spotting while taking the progesterone only pill. About 5 in 10 women will have no bleeding at all, but 4 in 10 might experience 3 to 5 episodes of bleeding during a 3-month period, and 1 in 10 will have over 6 of these episodes in a 3-month period. May also slightly worsen acne or cause breast tenderness. And again, if you do miss a pill for longer than 12 hours, again, take it as soon as possible, and you should use a condom as protection for the next 2 days. For both of these, an annual checkup is generally needed with your GP to assess blood pressure and BMI, importantly. Moving on then to the implantable and injectable. Now, these would fall in the family of the long-acting reversible contraception, or LARC. LARC contraception is something that we would be more and more inclined to encourage women to use, as first of all, it is more reliable, as you do not need to remember to take it. It also has the advantage of not being affected by if you get any sort of tummy bug or anything like that. And also over the lifespan of the contraceptions, it is more cost effective and cheaper than the oral contraceptive pills. So the implant or the bar is a small device that releases progesterone. It is implanted into the skin in the upper arm, and it's implanted using local anesthetic in your GP surgery. And again, it only takes a couple of minutes to insert. You'll be ever so slightly be able to feel or palpate the bar in your arm, but you won't notice it's there during day-to-day activity normally. It lasts for up to 3 years and then needs to be removed and replaced. It is the implant is the most effective form of contraception, being greater than 99% effective. It also has the advantage of stopping periods. Once it is removed, fertility returns to normal almost immediately. Similarly to the progesterone-only pill, you may have some episodes of bleeding or spotting. This generally occurs in the first couple of months when it is inserted, and you can have a trial of the combined pill for maybe up to 3 months, and this usually solves the problem. Side effects, you may have some nausea, again, perhaps some acne might flare, but that's about it. And then the injection or the Depo-Provera, again, it's a progesterone-only injection. It lasts for 13 months at a time, so you need to get 4 injections per year. Again, it has the advantage similar to the other progesterone-only devices like the implant or the pill, that it is safe while breastfeeding. But it may be associated with some weight gain, unlike the other types of contraception that I've mentioned so far. And again, the one disadvantage of the injection is that it may take for up to a year for fertility to return to normal once it's stopped. It also may cause thinning of the bones, so it is not advised to be used for greater than 5 years. Then the next 2 contraceptions I will discuss are the intrauterine system, which is the coil, or the intrauterine device, which is the copper coil. Again, these are long-acting reversible contraceptions. So the intrauterine system, or the coil, commonly known, like you might have heard of the Mirena, the Kylina, or the Jadis, are the 3 that are available on the market. There's a small T-shaped plastic device that is placed into the uterus. Again, it is greater than 99% effective. It releases progesterone and lasts for between 3 and 5 years, depending on the device, or if it is inserted after the age of 45, it will last for up to 7 years. Prior to insertion, it is generally recommended that you make sure that your smear test is up to date, and we would also do an STI screen prior to insertion as well. It takes less than 5 minutes to insert. Following insertion, there are 2 small thin threads will hang down into the vaginal vault, and you'll be shown how to feel for these, just so that you can check if you're concerned that it might be after becoming displaced or falling out. Your partner should not be able to feel these during intercourse. Again, the pros of the coil is that it's long acting. You don't need to remember to take it. It's very effective, as I mentioned, and again, fertility returns soon after it is removed. The 2 cons of this that we need to, are the 3 big downsides of it. First of all, it is a device placed into uterus, so there is a very low risk of damage to the uterus. The second thing is that if you do become pregnant while it is in place, there is an increased risk of the pregnancy being ectopic, which means that rather than inserting into the wall of the uterus, the fertilized egg gets inserted into the fallopian tube, and this has a risk of causing you to be quite sick. And then the third thing is there is a slight increased risk of pelvic inflammatory disease or pelvic infection while the coil is in place, and this is why we do the STI screen prior to this. Then the intrauterine device, or the copper coil, again, very similar to the Mirena coil or the hormonal coil. It's a T-shaped plastic device that is inserted into the uterus. Again, it takes a few minutes to insert, and again, the 2 strings hang down into the vagina. It slowly releases copper into the uterus, which alters the cervix, and it also stops eggs from being implanted. Again, it is 99% effective, and as I'll discuss a little bit, the copper coil can be used as an emergency contraception. The advantages of it, I suppose, are it lasts for up to 10 years, depending on the brand that's used. It works immediately, and there are no hormonal side effects such as breast tenderness, acne, or headaches with it. Again, fertility returns to normal soon after it is removed. The downsides of the copper coil are initially you may have heavier periods at the start. There's an increased risk or thrush may occur, and as discussed previously, there is an increased risk of ectopic pregnancies. Then the next 2 contraceptions again are less commonly used in Ireland. The patch is again a combined contraception, so it contains both estrogen and progesterone. Again, it is 99% effective with perfect use, or similar to the pill, 91% with typical use. You place the patch on a dry, hair-free area of skin, such as the upper arm or back, and replace it every week. You then wear it for 7 days and change on the 8th day. Generally, people wear it for 3 weeks at a time and have a 1 week long break. However, you can continue to use it. The patch, if it is to fall off, and you have noticed within 48 hours that it has fallen off, no extra contraception is needed if it has been used perfectly or normally for the 7 days prior. If it's been fallen off for greater than 48 hours, or if you forget to replace it for more than 48 hours, you should use condom protection for the following 7 days. The advantages of this, again, are that there are no GI side effects, or no side effects should you get a GI illness. You're not relying on absorbing a tablet. The cons, some people don't like that it may be visible at times depending on clothing. It doesn't confer any STI protection as discussed, and you may have some breakthrough bleeding at the start. And then the ring, the vaginal ring, the commonly used brand in Ireland is the Nuva ring. Again, it releases estrogen and progesterone, and it is greater than 99% effective when used perfectly. It lasts for 1 month at a time and then needs to be changed. It is inserted by yourself, and it's quite easy to insert using clean hands. Insert it into the vaginal vault until it feels comfortable, and then to change it, they describe it as being hooked out and can be changed very easily. If it falls out, again, within less than 48 hours, you've noticed that it has fallen out, it can be washed and cleaned and just reinserted. And if it is fallen out for greater than 40 hours, it will need to be reinserted with the use of condoms for the next 7 days. Again, the advantage of this is it is relatively easy to use. It doesn't, if you are sick or unwell, you do not need to worry about remembering to take it. However, the downsides, you may get some spotting or bleeding initially, and then again, unlike some of the other forms of combined contraception, it may take time for fertility to return to normal. And then lastly, just to mention the barrier contraception, which you all know is male condoms, female condoms, or the diaphragm or cap. These can be very effective forms of contraception if used perfectly and appropriately. However, this is not always the case. Obviously, it goes without saying, these do confer the advantage of providing STI protection. So even if you are using other forms of hormonal contraception, we still advocate the use of condoms and barrier contraception in order to prevent the spread of sexually transmitted diseases. And then just to mention emergency contraception, 3 main types available in Ireland are the 11L, the LO1, and the copper coil. The first 2 that I mentioned are tablet contraceptions. The 11L can be taken within the first 3 days after unprotected sex, or if you are concerned that you have may have become pregnant in the last 3 days, or the LO1 within 5 days. Both of these are available through your general practitioner, or they can also be obtained in pharmacies. The copper coil then, as has been discussed, can be placed within 5 days of having intercourse, and this is the advantage to be long acting. And then just to briefly touch on some prostate health for the male members of the Camogie Association. The prostate is a small gland that is around the urethra in men. This is the tube that goes from the bladder through the penis. About 1 in 3 men over the age of 50 will have symptoms of prostate enlargement. And what I mean by this is they might have difficulty initiating passing urine or difficulty stopping passing urine. They might have a slow or weak flow. They might find that they need to empty their bladder many times during the day, or in particular nighttime. It is the most common cause of cancer in men. And when men attend ourselves concerned about prostate cancer, we can take a history and do an examination. Generally, that involves palpating the prostate. There is a blood test that is available. However, we are selective in who we do this blood test on, as it can sometimes give us falsely high results, which can then lead to unnecessary investigations, tests, and medications. However, we would advocate that men do discuss this with their GP, and in particular, if you notice a change in your symptoms, such as that you are suddenly finding it very difficult to pass urine, or the flow has reduced greatly of late, or if you are getting up more and more frequently to pass by nighttime.
Fantastic, thanks, James. That was an extremely comprehensive review of the contraception choices available to everybody here. I learned a lot myself, in fact. Louise, perhaps we might go through a few things from your perspective and the Camogie Association. Is there any thoughts of your own or any thoughts of the members that you'd like to go through?
Yeah, that was brilliant, guys. First of all, thank you very much. I suppose a few questions that we had come in our registration. I suppose starting off with STIs, one thing that came in, if there's any long-term consequences to having STIs.
Yeah, there are. Unfortunately, there are. And, society perceives sexually transmitted infections in many cases as, just another, mishap that can be sorted out and moved on from. When treated early, yes, the results are very encouraging, but when not treated, there are sequelae that are quite concerning for both male and female. This really comes down to pelvic inflammatory disease in females, and also subfertility in males. Now, in pelvic inflammatory disease in females, this can result in chronic pelvic pain, which is a major debilitating issue, and it can result in extremely protracted courses of antibiotics, and perhaps most concerningly, it does impact negatively on the conception rates in ladies down the line. So trying to conceive is very challenging where there has been a history of an untreated sexually transmitted infection. And we have to mention that, like chlamydia, is a symptomless condition in the vast majority of cases. So in France and Germany, for example, people just attend for an annual sexual health check. And we really need to move towards that model in Ireland, where if you're sexually active, you go for a sexual health check. That's the message that we would love to broadcast tonight.
So I suppose regardless of having symptoms, it's important to attend those checks.
Yeah, I would consider an annual health check, an annual sexual health check for everybody who's sexually active as a responsible, prudent approach to their own health and to their partner's health.
Perfect. You did mention the smear test in there. Does that cover testing for STIs, or is it necessary to get separately tested?
James, go ahead with that.
So they will, during your smear test, first of all, the new model of testing tests for the HPV, which John discussed. So that's the first point called. And they also do tests for chlamydia and gonorrhea during this.
Okay, brilliant.
It doesn't, just to qualify that further, it doesn't incorporate a full sexual health screen. So if one has concerns or is sexually active and is seeking a full sexual health screen, I think it's important to note that your routine smear with the general practitioner will not incorporate a full sexual health screen. So James correctly said the human papillomavirus is looked at, but you know, other infections that I discussed earlier in the presentation, they're not routinely reviewed at the time of smear, and the person should always request a full sexual health screen if that's on their mind.
Okay, perfect. And I suppose the last one, just with a bit of a camogie hat on, if a member has got the coil or any form of contraceptive, will that affect them playing?
No, absolutely not. You can play as soon as that has been inserted, even if it is earlier on that day or that week. It is no issue with playing after the insertion of either the coil or the implant bar.
Brilliant. That's super. I don't have any other questions unless there's anything else you'd like to add.
No, thank you. And thank you, Louise, and thank you to everybody in the association. I think it's a wonderful program that you're running in terms of the health awareness of the members, be it regarding what we've just discussed or the alcohol or the breast cancer. These are extremely valuable initiatives to your members, and well done for organising it.
Thank you very much, guys. And just a note from the Camogie Association to thank you both for coming on and contributing to this webinar series. Our next episode, just for our members' information, is on Monday night, and that'll be live on Zoom with the links sent out for that. So 7:30 on Zoom, and that one is on preventative screening. So thank you very much, and we'll see you all on Monday night.
All the best.
Thank you.